think you've got 2 minutes before 4, right?
Yeah. Good afternoon, friends. I'm Dr. Aajay Shah, and we are bringing this another great live today. Let me give you a quick update on our page. We have now 62,000 followers, about 25,000 from US and many other countries. We are actually adding all different type of activities on our page. My wife is doing healthy cooking shows, and to be honest with you, her cooking videos gets 3 to 4 more times live than even my videos get. So big thank you to my wife. We are also bringing various guests, and they're all contributing to our movement. So my big thank you to all the guests who are coming on our live. Also, big thanks to Hannah, our social media person. She's been doing tireless work for last 6 months. I think because of her, we have grown like this, and we have helped thousands of people. So big thanks to Hannah. Today, actually, I have a special privilege. I have a special guest. She's a leader. She's actually a big leader in our lifestyle physicians group. She keeps all of us organized. She keeps everything organized. But the most important aspect about her is that my mentor, Dr. Kaushik Reddy, and she actually is his mentor, and that's his wife, Dr. Angela Reddy. So let's welcome Dr. Reddy.
Thank you, Dr. Aajay. Thank you. And thank you for being our mentor and our leader, and for having this vision of putting together these lives and these amazing streams of wonderful topics that interest so many people in so many different ways. So I applaud you for your hard work and for your determination, your perseverance in this community that we live in. So thank you for your hard work.
Thank you. Thank you. So let's start with telling us, where do you live and what type of medical practice have you been so far, and where you are headed for the future?
So my family and I, my husband and our 3 children, we actually moved from New York, and now we live in the Tampa Bay area. We've been here for the last 15 years, actually 14 years, and coming through this town with young children. I left New York as a hospitalist, where I had worked there for about 8 years after I graduated my internal medicine residency. And from that, seeing so many patients getting sick and dying in front of me, it was a bigger calling for me to say, you know what? I need to go into some type of a prevention, because it broke my heart, right? We went into medicine to help people. And why were so many people with so many different comorbid conditions that were dying in front of me in the hospital? So as a hospitalist, I wasn't fulfilled. When we moved to Tampa, I wanted to do outpatient medicine. And what best was for me to serve our outpatient community. And so I decided to do an outpatient at the VA hospital. And I started working at the VA outpatient clinic because I wanted to serve our vets. I think they deserve the best medical care, because they actually, they gave their life for our country. So I joined the VA outpatient clinic here in Tampa, and that's where I worked for 9 years. And so during that journey is where I realized that, you know what, my patients were just not getting healthy. So here I was going outpatient, thinking that, you know what, I'm going to be able to do something in the preventive aspect. But there I was chasing a hemoglobin A1Cs, high blood pressure parameters, increasing the meds, increasing their insulin. And what was happening is that these patients were gaining a lot of weight on all the insulin that I was putting them on. Little did I know that I was actually doing a disservice to them. Yes, I was managing their blood sugars, but they were gaining weight. So how was I really helping these patients, right? So I had an awakening that there was something else that I needed to do in life, another calling. So that was about 17 years of that whole medical journey. And then I started to dig deeper into what is my true calling. And that's where I bumped into the lifestyle medicine arena. And wow, it was rejuvenating. It really gave me that breath of life, that there's more to medicine than just writing a pill for every ill. And it brought me into this journey. And now I'm really excited, because now I can do more because this pillar has brought me a second chance at medicine. So in so doing, I went and started doing some virtual work, and then now I'm looking at different career opportunities and different segments, and hoping that this is where we head for the future.
Yeah, I think I agree with you. I think I feel same way about lifestyle medicine. This is like my second career, so my second opportunity. And I think we all need to do, various aspects of getting this lifestyle medicine and a household thing. Everybody needs to know about lifestyle medicine, and we need different type of leaders. And I think you bring certain skills and certain abilities, and we all need, all the people to join our movement. But I also have a very high respect. Obviously, veterans, I have extremely high respect. Veterans well-being is one of our pillar, one of our important pillar. And to be honest with you, people who actually take care of veterans, like your husband, Dr. Kaushik Reddy, and you, have actually even bigger respect for me, because not just you give up on a lot of the lucrative, money-making deal with most physicians get into. You are actually serving the veterans who have served our country. So big thank you to you. So let's start with our 6 important pillars of healthy lifestyle. What do you think the most important pillar, the role of healthy eating in healthy lifestyle?
Healthy eating brings life to our body, right? So we need to engage ourselves in food that bring life, bring nutrients, make us feel our very best. So healthy eating is our biggest decision every day. When we wake up and we enter our kitchen, what are we going to grace our body with today? What are the foods that are going to make us feel alive and make us feel our optimum? So our entire family, we are part of the whole food plant-based lifestyle. Our 3 children and my husband and I, we wholeheartedly believe in what comes from the ground is what we need to put into our body. So a lot of greens, grains, legumes. This is our new founded lifestyle, and I feel younger now than I did 10 years ago. So this is just proof that healthy lifestyle does work, because it's given us a second chance at life.
Yeah, I think I agree. Healthy eating is probably the most important pillar. And if someone wants to get into a healthy lifestyle, start changing the how we eat. And as Americans, we eat 65% processed food, 25% animal products, 10% plant-based food. And most of the plant-based food is processed plant-based food, including French fries and ketchup and Oreos. And so truly only 2% of our diet calories come from whole food plant-based. And I think that's where I think as physicians, as a coach, as leaders, including you, including me, we need to practice what we preach. And when people see how good we feel, how vibrant and how lean we look, I think people start to appreciate that they can achieve the same thing if they start eating healthy. So let's go to the next pillar. Next pillar is a physical activity. We always exercise, but now we know physical activity is a better way to describe how we move. So please tell us what is the role of physical activity?
We need our physical activity to increase our blood circulation, to keep us alert, to get our joints mobile, to get those joint fluids to move, to get our cardiovascular health in shape, to get our stamina better, to help our mental alertness. If we don't exercise, we're not allowing our body to produce or become its very best. So the cardiovascular output, our exposure to the sunshine, to be out there, to be part of nature, to get those joints moving, and those walks, those morning walks, whatever it is that makes a person move, to help with balance as we get older, to help with bone rehabilitation, bone strength. This is all with, having a little weights in our exercise routine. So for every pillar, this is one of the most important pillar. Children today are having a very difficult time with this pillar, because a lot of children today are engaging in a lot of sitting and a lot of video games, a lot of television, and then eating that unhealthy food, the junk foods, the chips, the cookies, the sodas. And our poor children today, their alertness are not there, their optimization in their schoolwork, their functioning, their hyperactivity, these things are all being taken aback because they're not able to go forward but by that healthy lifestyle.
No, I agree. I think physical activity is very important. At the same time, we all are realizing, we all are learning that physical activity is almost like a supplement to healthy eating. Healthy eating is the main thing we have to do, and then physical activity supplements. People who are active, whatever the reason, they are traditionally a better eaters because they understand the value of nourishing their body to have a better physical activity. And you also cover a lot of important things beautifully in like 3 minutes. That balance training is very important. As we get older, many falls happen because of the balance issue. Core is important. Core activity is very important. Yoga is very important. So I agree. Physical activity, not just cardio, but light weight training to prevent the osteoporosis in women particularly. So all different type of physical activity will be very important. That brings to our next pillar. Next pillar, which your husband, Dr. Kaushik Reddy, clearly says, the sleep. So what are your views on sleep? Do we get enough sleep as Americans?
I think there's so much stimulation, Dr. Shah, in our society today between the phones, between television, between the computers. People are spending longer times viewing their Facebook feeds, and they're waiting later to get to bed. And so sleep is extremely important for very important thing for our memory. And a lot of people don't realize how important sleep is for memory, and that 7 to 8 hours of sleep is what we need. And the way I look at it is that during the day, we're learning so much and we need to store this in the hard drive, right? So we have to upload this information every night into our hard drive. And when we wake up the next morning, we're waking up as a sponge if we have gotten that 7 to 8 hours of sleep. And many studies have shown that sleep decreases all-cause mortality. And so sleep itself is healing. Our body heals. And sleep is something that we don't have to pay for if we do it right. And it's one of the things that gives us one of the most amazing benefits is to be able to sleep. So in my opinion, I feel sleep is a blessing. And if we're able to sleep, we have been blessed. If we're having difficulty sleeping, we need to revisit those areas and try to figure out what it is that is affecting our sleep. Is it our mind has too much on it that we take to bed? Did we kind of de-stress before hitting the bed? Did we stop drinking alcohol before going to bed? Did we cut down our caffeine in the daytime before going to bed? Did we get some melatonin exposure? Did we go out into the sunlight in the afternoon for about 15 minutes? Have we done that? Because these little things will help us to get sleep better. And a few pistachios and cherries before in the evening will also help with melatonin, because some of the studies have shown that pistachios and cherries will help with melatonin production as well. So if we're able to regulate our sleep pattern, and one of the most important thing is making sure that the temperature in the bedroom is cool, right? So a lot of people don't realize they go to sleep and it's very hot. So if you're able to maintain temperature about 65 to 67 degrees when going to bed, the studies have shown that those are the temperature that you would have the soundest sleep of all. Now, people may not have that air condition or they're not able to cool off before bedtime, but making sure that those things and making sure that there's no bright light in the bedroom, the curtains are all closed, and making sure you don't eat a high fatty meal before going to bed is also important. So if people just realize that these little things that we can take and we can change our healthy lifestyle and make it even healthier, sleep is one of the things that we cannot afford to lose.
Wow, very beautiful way you describe. Matter of fact, there's a book called Why We Sleep, and you summarize the whole book in like 3.5 minutes. So people don't have to read the book, just listen to this 3.5. You cover every aspect, how we can get a better sleep, why sleep is important, and memory part. Many people forget. Many of us know that memory is the one which we start to lose as we get older, and that doesn't have to happen. People in blue zone, they have strong memory, they have very healthy memory up to their 100 because they sleep well and they all have other pillars pretty much covered. So I agree, sleep is very important. Matter of fact, many women don't realize that there was a study done that after 2 nights of poor sleep, when the pictures were taken of their women, the independent observer thought Not only they were older, but they were not as attractive. So sleep actually makes you very attractive too. So I think for all the reasons, sleep is very, very important. Let's go to our next pillar. Next pillar is also very important, and that's a stress management. We live in a fast-paced society. We all have multiple obligations, multiple distractions. So number one, how do we manage stress? And number two, how do you balance your life with all these responsibilities and obligations you have?
So Dr. Shah, stress is something that nobody knows exactly if there's no playbook for stress, right? So we all try our very best to balance it. And how do we do that? And so me personally, it's very important that when I start my day, I have it thought out. What are the things that I need to accomplish today? So if you start the first thing you do when you wake up, make your bed. It's your first accomplishment, right? Brush your teeth. And then as you're brushing your teeth, take your shower, you're starting to play about what are you going to do for the day. So if you have a mental thought process, and you can visualize how your day is going to turn out, you're going to be more accomplished that day. And what I started doing is writing down the things that I want to really accomplish today. And so if I could write these things down, what would happen is that you would decrease your anxiety and you would be more accomplished by being able to know that these are the things that must be done in order for you to move forward and be productive. Because at the end of the day, you want that mental well-being, that you have accomplished all the tasks that you had set forth to do that day. And you want to make sure that you feel that you have grown, you've learned a lot, you have given back to society, you've done your duties as a mother, as a wife, as a doctor, or whatever occupation you're part of. You want to feel that mental wellness at the end of the day that you have accomplished. And every day that we wake up is a new day that we have to live. And we've got to make sure that we are living our life with a purpose.
Yeah, I
And
think I agree with you, and I think you said in such a perfect way to start this topic that make your bed. And matter of fact, there's a whole book titled "Make Your Bed," and that book was actually written by I think a Navy admiral who actually gave a whole graduation speech on make your bed. And people don't realize that simple as making your bed, start your day in a right way, and that first win in the early morning by making your bed. And to be honest with you, I think that's how our life is, that have small wins starting early morning. And by the time you know it's time to sleep again. So I think stress management is very, very important. That brings to our next pillar. Next pillar is substance abuse and alcohol. And you partly covered during the sleep. So what are your thoughts on this opioid crisis, alcohol addiction, even people with alcoholism? I mean, how can we overcome that societal addiction to these substances?
so when I did my outpatient practice, we saw alcohol as a way that people were able to mask their depression, their anxiety, and their pain that they were feeling, loneliness, emotional pain. And when you go to the heart of the matter, loneliness is a big thing. And a lot of people are taking that alcohol to be able to calm that loneliness, to be able to make them feel, that they have that purpose. I think what's happening in our society today, communities are not being built. There's that social connection that's missing. And people are hitting the bottle, and people are thinking this is the only way out. And with the opioid crisis, we've dealt with so many people with the opioid in our practice. And that addiction, it was very hard to get these patients off those pills. And there were programs that we were supposed to refer them to help them get off the opioid. But opioid kills, and we've seen so many deaths, and this is a crisis that needs serious intervention. And same thing with cigarette smoking. It's another high stress environment that would allow people to smoke and just being in social circles. And so if someone is trying to, just getting off cigarettes or stop drinking alcohol, they need to change the circle of people that they're around in order to make this successful. And you've got to want to do it. Nobody's going to be able to make you do it. That's the most important thing. You've got to want to, and you've got to see your why. You know there's a problem, identify the problem. If you can identify the problem, only then we can intervene and we can help.
I think I agree with you. I think substance abuse and alcohol is a personal responsibility. And I think at the same time, I think if you have a right kind of support, if you have a other way of replacing those habits, I think if you make a new friend, if you take up a new hobby, if you pick up a new book, I think if you replace those habits with something positive, it'll be easier instead of just deleting them. I think I always feel like replacing a bad habit with a good habit is better than just keep trying to delete the bad habit. So that brings in a very important pillar, and that pillar is the relationship. As we know, I think when you are not having a healthy relationship, when you are not having healthy family and healthy friends, many of those other five pillars suffer also. So what do you think the role of relationship when it comes down to healthy lifestyle?
I think this is one of the most important pillars of lifestyle medicine: social relationship, social interaction, and being able to come out and speak to your neighbor, saying hello to the garbage man, being able to speak to everybody in your community. So community is important. Anger management is another thing that affects a lot of relationships. Being able to compliment your and your friends, your family, complimenting, helping them to the next level, not losing your patience, hanging up the phone, disrupting those conversations. People are not able to handle stress, and they vent by many different ways, whether they throw a tantrum, they get angry, they get upset. Those things, it is so easy for our society to break, because these relationships are not we're not working hard on building these relationships. And relationships are pivotal for our social circles. It's very important for our longevity. That, like you mentioned earlier, in the blue zone communities, they have an entire community. They do things together. They plant their gardens together. They share their crops together. They have social gatherings together. So social circles are extremely important, and with the right people. You don't want to have social circle with toxic individuals. You want to be able to help those individuals be better. So loneliness is a big issues that we're facing in America today. A lot of people are lonely, and a lot of people are not able to ask for help, but they're afraid to reach out to people because they feel that people are going to judge them. But loneliness is a real deal, and it's important that we are able to find those community and help individual come out, and help individuals know that communities are there to support them. And that's what we are working hard on in Tampa, is to build communities, and knowing that we are here for support for our community is very important to our work that we're doing here.
I think I agree with you. And we have talked many times before that loneliness actually is as bad as smoking when it comes to heart disease. So I think, having social relations are very important. All blue zones, actually something out of this COVID-19 crisis, something good has come out, that a lot of the elderly people are comfortable now with FaceTime, with the Zoom calls with their family. And I think that has added some value to be able to see the family members, their face, instead of just talking on the phone. I think so. There's always a way of having a social relations. You don't have to see them in person. You can always see them on Zoom. You can always see them on FaceTime or WhatsApp video calls. And I see my parents all the time, even though they're in India, on a WhatsApp video call. I can see my dad anytime I want to see how he's smiling, how is his face look like, whether he has gained weight or not. So I think we should teach our elderly people how to be smart with this technology. So some of the social relations, particularly in women, because as men dies 4 or 5 years before women, I think many of these women after their husband died, they are so lonely. But if they can start connecting with their friends and their family members over this video call, that would be a great thing. That brings the next kind of interesting topic. Like I said earlier, whenever my wife makes any healthy recipes on the live, she gets like 5,000-6,000 views. And most of my lectures, my talks gets like 500 to 3,000 views. So she always has double views than I have. And that brings my kind of admiration for you and Dr. Reddy, Kaushik Reddy, that you both just joined a culinary school. So please tell us, how are you going to kind of add one more thing to your plate? What are your plans in terms of teaching a family, friends, and other people and patients about, because at the end of the day, no matter how much knowledge we have to be able to cook healthy things. And that's the reason Chef AJ, who you and your husband were on the show, and I love that show, Chef AJ. I admire Chef AJ because she actually brings the practicality of healthy eating instead of just feeding the knowledge. So please tell us about your culinary school.
Oh, so my husband and I, we love to cook together, right? That's another part of our relationship. It's that social interaction, that the social relationship. And we, as we're cooking, we're talking, we're chopping things up. And our children have been watching us do this over the years, right? So they have been also very inspired by our cooking. So I really wanted to do this culinary thing. And we've gone to Lifestyle Medicine Conference every year. And every time I say I'm going to do it, I'm going to do it. And then I said, my husband says, you know what, we wish we had a chef, And I said, why don't we just become the chef? Why don't we just do this ourselves, right? And so we both register for it. And now we've got all these preparation pictures that we have to cut, and we've got to take pictures, upload it to the site. And the kids are watching us do this. And I have to tell you, Dr. Shah, yesterday, our daughters, they're teenagers now, they said, Mom, Dad, we're making dinner for you. So I have to tell you that they said, but don't come into the kitchen, okay? So we let them do what they have to do. All of a sudden we come out, there is sushi, vegetarian sushi, there is Vietnamese pho, there's a cabbage egg roll that's not made with egg. It's just one of those, it looks like an egg roll, but it's all vegetable inside with tofu. It's cauliflower, and they laid the table out so beautifully. So as a parent, it makes you happy because you are trying to instill these values in your children, and you're trying to be that role, you're trying to be a role model for them. And when you see them do these type of things, it really makes your heart warm, because that's our legend, is leaving something for our children to model and follow. So this plant-based chef certificate is just another feather in the cap. Like, you've got multiple. I just thought this was going to be fun, and it's going to be fun. And my partner and I, we will continue to just have fun doing it. And it's another way for us as husband and wife to have a great social relationship.
Yeah, I think I agree with you. I think some activity together, whatever activity you like, has to happen between wife and husband or between the partners. And I think we are definitely bringing you on as a chefs, not just as doctors and leaders, but as chefs also. I think people will watch that more than even any other time we are together. So we're definitely bringing you as a chef. That brings my next kind of another feather in the cap, that you are pursuing executive MBA program. So how are you going to utilize those skills and education to further advance lifestyle medicine?
So Ajay, Dr. Shah, you and I both know right now, as physicians, we spend time in lifestyle medicine educating our patients about how they should be eating and healthy living. There's no compensation for those kind of work, right? And this is pivotal. This is very important. If we can hit it from the preventive aspect, right now, we spend about $4 trillion a year in healthcare, about that, and about 17% of our GDP goes to healthcare, right? So our country is in a disaster right now when it comes to healthcare, because a lot of our healthcare is spent on treating diseases that shouldn't even exist. 80% of these chronic diseases shouldn't exist. For example, a bypass surgery is about $100,000. And so what if we prevent that bypass surgery? And you and I both know that coronary artery disease could be reversed to a degree with a healthy living and healthy lifestyle. And so Dr. Esselstyn has shown that in his coronary angiogram, and we have seen that. And you and I know about patients that have reversed their angina, or they're able to have better stamina, they're able to have better lifestyle by just losing weight, eating healthy. You and I have seen that, and we've heard it in so much of our community. So when I saw this, I said, how are physicians ever going to be motivated, or how are they ever going to be making a living if they're just doing lifestyle medicine without any compensation? We might as well just do free work, and that's what we've been doing, right? So I said, if I don't speak the language of corporate executive, right? Everything at the end of the day is show me the bottom line. Show me how I'm going to make money is what a lot of corporate executives are looking for. And so something simple like the Geico study, what PCRM did, right? And just taking Geico insurance employees and say, hey, you know what? We're going to follow you on a healthy diet for 18 months and let's see what happens to one group of individuals. And those group of individuals that went on a vegan diet or a whole food plant-based diet, their productivity, their alertness, their mental wellness, their decrease in pain, their overall well-being improved within Geico itself. So Geico in turn turns around and says, you know what? If our employees are healthier, they are more productive in the corporate world. And if they're more productive, then you as an employer, you're gonna be more, your bottom line is gonna look better. But the key is if you don't have to spend so much insuring your employees, you are going to save money at the end of the day or the end of the year when you look at your annual budgets. So I want to be able to have that language to speak to the corporate executive and be able to influence lifestyle medicine in the corporate center. But I'm open to everything to say, how can we bridge the gap with lifestyle medicine and being able to help individual physicians practice this way of life? Right? So this is the reason I went back and I said, let's do something to make lifestyle medicine on the radar. And so if it's something that I can accomplish in my lifetime, I'm going to be very happy. So I just want to have another language. It's like learning Spanish or French. It's a different language when you're speaking to a corporate executive, right? So it's a dream. Let's see if it'll accept me the way I accept it, and we'll see where it goes.
I think you made a very important point that the bottom line is how financially, how economically sustained any movement, any process, not just in medicine, but anything in the life, it has to be economically sustainable. And I think many physicians, unfortunately, are not very good at economic aspect of practicing medicine. So that's one. So I think person like you going and getting a degree, a business degree, and then leading many physicians to give us some guidelines and some tools to become better at business of practicing lifestyle medicine. And the second important thing, like your husband always shows us the slide that in America, the pyramid is reversed. Actually, primary care are at the bottom, and the people who make big procedures, write big prescriptions are at the top. They're actually almost milking the system. So we need to make the pyramid properly structured. Otherwise, so that means lifestyle physicians, primary care physician should be properly reimbursed for their time, for their efforts, for their passion, for their compassion. And I think to do that, we need to speak a corporate language. And a person like you, not just is going to help yourself, but actually also going to help thousands of physicians who want to practice lifestyle medicine. So big thank you to you. My next big point, which is another feather in your hat, is that you also have a nonprofit organization in Tampa. So please tell us that what was the reason for going nonprofit, how active it is, and how people can join.
Absolutely. So lifestyle medicine, as we just spoke about, right? It's we're taking this to the community, and we're not looking to make profit. We're looking to educate our community. So my husband and I started this nonprofit, and we said, you know, let's see what kind of response we're going to get from the community. How many people are going to be interested in participating in a lifestyle medicine conference? So our first conference happened last year, and I want to say a little less than maybe 180 people register for this conference. And it was just mind-blowing to have a conference where people come seeking information about what they can do to live better, to eat better. And we had a beautiful panel of doctors and questions and that were asked, and people, and it became a beautiful community event. People they went on a walk after lunch. We had plant-based meals that was served there, the lectures and the data that was presented, and all kinds of questions were being asked that day. So we got really excited and said, you know what, we will continue to do this in different parts of of Tampa. And we started doing it. We went and we did another conference in St. Petersburg. We did another one in Hernando County, and communities are accepting us like, hey, we never ate this way, but we are really open to learning how to eat more whole food, plant-based without sugar. And, you know, some people come, oh, vegan. I'm a vegan, but I haven't reversed my disease. I'm still overweight. And then when you go through it and you realize that people are drinking sodas and eating chips and they're thinking this is being vegan is to be healthy, we said, no, it's got to be more of a whole food diet, and it's got to be something that is not processed. And so educating people to make the right choice is, it feels so amazing to do that. We have to empower as physicians. We have to help our community to gain that knowledge so that our community can make changes in their life and their family's life. So this nonprofit, pblm.org, that's plant-based lifestyle movement.org, is giving us a platform that we can take this to our community, and we can do series of talks. We can do healthy cooking demonstrations, and maybe that's where the chef thing will come in handy. And we'll be able to demonstrate that we can eat this way and feel amazing. So we're really hoping to build a strong community here, and hopefully we are able to shine light. And that's all that we want to do, is shine light on this community, and have a presence on social media and empower.
Wow, that's great. Now, I think that's a very noble cause. And my question on that regard is that, can people outside Tampa be part of this nonprofit organization and learn from you on an online platform?
So that's all in the works right now. We're looking for a 501c3. And once we get that, that takes a few months in the state of Florida to get that. Then we're going to do those live demos, and we're going to do this educational platform for people who are not in the state of Florida. But the live seminars are just amazing, because so many contacts you make and so many lives you're able to touch with that live seminar. So our goal is to make it more of live seminars, and of course having it on a YouTube platform and a Facebook social media that helps and empower people from different states as well.
I agree. So now next question to you is, what do you think the role of corporate health programs are, or executive health programs are? Many physicians are trying to get into helping various corporations to keep their employees healthy. And you just mentioned about the Geico study. So I think you are kind of specializing into it. So what is your advice to physicians who also want to look into corporate wellness program?
I think understanding the language of what corporate executives are looking for, and like we alluded to earlier, understanding those balance sheets, understanding the language that they need to hear. And so balance sheets is very important to look at, because that's how you're going to make a determination of where your intervention should be. And physicians who are interested in this at least should have, they don't necessarily have to go back to school, but if they have that verbiage, if they're able to speak some of that language, and be able to implement pilot programs. And so I feel that if we are able to have pilot study, just like the way Geico did it in various institutions, we're going to be able to study those patients that are in those arms and be able to show results at the end of the year, that this is how much we were able to save for your company, because we were able to bring down the diabetes, bring down the hypertension, decrease hospitalization, decrease ER visits. So if you're able to have an analytics, so analytics is important in anything that we do today. And so that's one of the things that I wanted to learn, is that data analytics. Everything is about data mining, data analytics. And so if you can speak the data language and speak the analytic language, it's important that you can present that at corporate functions and be able to say, hey, you know what, I have an idea. Because think about it, right? The health insurance companies, it's going to take a while for them to turn around and say, you know what, we're going to reimburse doctors for doing the right thing and reducing and having those patients who they're seeing in the office reverse some of those chronic diseases and reimburse those doctors. So that's a wheel that is spinning, but nothing has happened yet. So in the meanwhile, how about we go to corporate America and say, listen, let's intervene with your employees, especially if your company is self-insured. If you're self-insured, it is in your best interest to get your employees healthy. And many companies are doing this now where they're allowing rewards that go back to the employee for weight loss. So you may have to say, well, 3 times a week you're going to the gym. You started off with a BMI of 30. Now your BMI drops to 29 and 28, and you start to get reward bucks back to the employees. So for corporations to start looking at this model where they're rewarding the employees for healthy living and healthy activities, this would be a nice corporate structure for sure.
You hear anything?
I think you've got, yeah. So yeah. So I think that would be the way that physicians need to look at this, and lifestyle medicine having the understanding of what those lifestyle pillars mean. You can have these conversations with different corporate executives, and I think we can all make a dent and help those employees, and that's how it's going to branch into the community.
No, I think I agree with you. When I talk to my own hospital, the main interest was because our hospitals are self-insured when it comes down to health insurance. And last 2 years, whatever the reason, our health insurance cost has gone up. So their main interest was, how can I help them to improve the lifestyle of our employees, our hospital employees? And like you said very correctly earlier, that not just improving the health insurance cost, but some of these employees become more productive. So a nurse who is happy and healthy and has slept well probably will discharge that patient 2 hours earlier, and that's a lot of dollars and cents. So I think it's just not saving only health insurance costs, but also making all the employees very productive and less errors also. Medical errors is a very expensive disease. Medical errors cost us billions of dollars. And if a nurse or a doctor, for that sake, make less medical errors because they are healthier, hospital will save money in the long run. So I think corporate wellness, corporate health is very important. I'm glad you are leading us in that. So my next question to you is that please tell us where this American healthcare, or I call it a sick care, is going. And if you are concerned about it, what are your thoughts, how we as a society, how as a government, how as politicians can turn us around and get us healthier again? Because for last 100 years, heart disease is #1 killer. One would assume that if something is killing you, in 5 years, 10 years, you will learn your lessons. But we haven't learned our lessons for 100 years. So what are your kind of visions, how our country can turn around?
Very, very great question, Dr. Ajay. In light of the pandemic, as we are seeing, the people that are getting more sick and the people that are having high mortality are those that are obese. And so looking at America, the status of America today, when you're looking at overweight, add obesity onto that, we're looking at a 70% of our population is either overweight or obese. And this is just not acceptable. For a community to heal, this pandemic has really waken a lot of people up. And so diabetes, hypertension, heart disease, lung disease, these are all chronic diseases. And most of them are chronic diseases. And in light of the pandemic, a lot of people that have had higher mortality are the people in those categories. And when we're looking at Europe, and we're looking to America right now, the Europeans are not as overweight as Americans. And so we have to start with weight loss. We have to reach our ideal BMI. If we don't do that, we are not going to be able to sustain healthcare. We are not going to be able to sustain as Americans, as a society. And right now, even our military, even our young military men that are going into war, right now we can't even recruit enough of enough men and women into an army or navy because they're overweight. And so if we have a sick population of people defending our country, we are in a major, we are in a major trouble. So healthy lifestyle, we have to implement this, or it's this country, we are not sustainable as a society. And for the work that you're doing and many other lifestyle physicians out there that are spending hours upon hours and days upon days to change one patient's life at a time, this should be noticed. This should be noticed, and this should be the hallmark of how we practice medicine. We have to turn this, we have to turn this around. If we don't turn this around, who's going to defend our country? For the next pandemic that comes our way, are we ready as a nation? We don't know where this pandemic is going. We don't know who it's going to take with him, right? So right now, our society is a very unhealthy society. Overfed, we're overfed as a society. What we're eating is overprocessed. We lack the skills to prepare our own meals, and we lack the education of what should be food. Food should be our medicine, and we're not realizing that food is our medicine.
No, I think that's excellent point, and I think we need to change as a society. Our priorities are slightly messed up, and that's where I have a kind of a great privilege to be a part of our lifestyle medicine physicians group, where we have some great leaders. I also feel about Dr. Padmaja Patel in Midland, Texas. She's moving the whole community. And I think we need to start thinking on a larger scale as physicians. We need to cannot just stop by thinking about our 1,000, 5,000, 10,000 patients. We need to start thinking as a leaders, as a visionaries for the whole society, and we have to start our own examples by following the healthy lifestyle. So I think we need to go beyond the four walls of our practice and go more out in the communities. And whether they are our patients or not, we need to teach everybody we can, regardless we get paid or not. And I think some of it's obviously as a volunteer, some of it's just an altruistic thing to do, some of it's just a passion, some of it's giving back to society, but we need to do that. And that's how we're going to turn around this sick care. Otherwise, we're going to keep dying, and next pandemic will only kill more people. So I agree with you. I think that brings my next question to you, that please tell us and guide us that how, as lifestyle medicine physicians, how we can grow to have more influence, not just into our medical associations, but also as a society, as a more of a leader when it comes down to leading the medicine for next 100 years. Until now, it was always the neurosurgeon and cardiothoracic surgeons and some of those heart specialties who were leading, who were getting all the rewards and all the gratitudes and everything. How can us as a lifestyle physician become the #1 leader to lead the medicine?
Policy's got to change, Dr. Shah. We've got to get into our congressmen. We need to get this into the people, the House of Representative people that are going to make these policies. And if it doesn't start from that state level or county, state level, it's not going anywhere. And so with our social media platform, getting the message out, Dr. Greger and what he's doing, PCRM, I mean, amazing work from so many people across the world. And it's still not being recognized as a way of practicing medicine. So it has to start with our local government, and from the local government making its way to Congress and making its way to changing policies, reimbursement, shining the light of the doctors that are in the front line, literally saving lives of their patients. And the primary care doctors are in the trenches, and primary care doctors, and I feel for them because I was there at one point, because primary care doctors just watching over the patient and being able to handle so much and have the least recognition and least reimbursement from the bottom of that pyramid. So primary care doctors need to be taken to the next step, the next level, because they are steering the ship. And if they don't steer the ship, it's going to go into the wrong direction. So I feel that it has to start from a government policy making. And this is how we're going to get this needle or this pendulum to swing.
Yeah, I think I agree with you. I think we need to get more active into civic duties. We need to start contacting more of our political leaders and even government workers and people who make policies, because at the end of the day, I think a lot of the good programs come out when the government jumps into it. So I think we need to change how government is thinking. So my next question to you is kind of a philosophical question, and you wear a lot of hats. So this hat easily as a philosopher, that you being a successful physician, leader in a lot of different organizations, also getting now executive MBA, how a person can grow as a successful human being, and how that person can actually inspire others and balance kind of health and other desires to gain material success, because you are balancing a lot of these things. So what is your teaching to people who actually want to be like you and be balanced and be successful and be a leader and empower women? Matter of fact, one of our pillar is a woman empowerment, and we need person like you to lead many women so they can be empowered. So one day soon, hopefully, man and woman will be treated 100% equally.
I thank you, Dr. Ajay, for recognizing the role of women in society today, because a lot of society, they're not giving credit to what women go through, and women have a lot of hats to fill. Not just work. Work is always on the back burner. Children, household responsibilities. A woman multitasks. And sometimes she puts herself aside to make sure her children are okay, make sure the home is okay, make sure her spouse is okay. And she takes the last meal while everyone else is getting fed. So women need to come together and understand that we are supposed to build each other up. We're supposed to lift each other up. And what my philosophy has been through the years is that I will never stop being a student. I will never stop being a learner. I love to learn through observation. I love learning from people. And I've had so many mentors along the way, and I've learned from them through observation. And I feel that women need to continue to grow. And when I say the word grow, not physically growing, not waist-wise, but grow mentally and emotionally. We need to grow alongside of our children. As our children are growing, we need to take on a new skill. We need to take on a new certification. We need to continue to build ourselves, because at one point we're going to become empty nesters. And when we become empty nesters, we have to be able to have something to fall back on, that this is our mission. This is what we're doing for society. So we should never stop growing. And I think a lot of women, they have so much on their plate. It's very difficult for them to learn that new skill or learn that new certification. But women together in numbers and being able to motivate one another, especially in the platform that you and I are in, the wonderful, strong women in that platform. I know how much they are multitasking as physicians and mothers and wives. I know what they're all in our boat. And I know they're all growing, and we are growing together as lifestyle medicine physician in our group. And I'm so thankful for that group of women that have made me stronger as a woman. When I see what they're doing, looking and observing what they're doing, just motivates me and take me to the next level. So it's important to flock together of birds of the same feathers, right? So this way you fly together, and people that pull you down, you just need to break away, and you need to just grow with the people that will uplift you, motivate you, and help you be that person that you are wishing to be. And that's how a woman feels content. And that's where she gains her confidence from, is when she can fulfill the desires that she wants to fulfill, her children being the most important thing in her life, and her spouse, and then her parents and family. But a woman needs to make sure that she is content and she's confident in the things that she set out to do. So as women, we should continue to grow, and we should continue to learn from one another. And we should take time for self-care and time to make sure that we have that moment of meditation, that moment that is called our alone time. And we should just share with one another.
Yeah, I think beautifully said. I agree with you. I think, matter of fact, women empowerment is one of our important pillar, and we have, from my my role, that we are bringing 1 to 2 guests every week on our Facebook Live specifically to empower the women, because that part needs to be taken care of ASAP. That's been suffering for the last 5,000 years. You know, if you read about it, before 5,000 years, men and women were treated equally. We have a lot of goddesses in our Hinduism, a lot of other religions. So it's just about 2 or 3 thousand-year-old history where men started to dominate the society. So I think that suffering needs to stop. That's high time now. So we have all different type of women. We had a Iraq vet woman who is a wife who is actually working in a research lab. She came and gave her story. We had a massage therapist, a woman. So I think we are bringing all different type of women to see how we can uplift every woman, not just educated women. We need to uplift every woman, not just in America, but in the whole world. So I'm glad you are doing it. I'm glad I'm doing it. And I'm just going to ask everyone I know to keep doing it. So my last question to you is, which is again, another philosophical question, that right now we are going through this COVID-19 crisis. We are going through obviously healthcare crisis. We are going through a lot of political crisis, including a lot of division, a lot of other things, a lot of different movements. So as a nation, how can we come together from all different parties, all different color, and whether you are an immigrant or not, as a nation, how can we come together to make us all healthy, live long, and again, make our country just one large, big blue zone?
I think right now there are different blue zone projects happening in our country. And again, everything runs on data, data analytics, and getting results for those blue zone. Blue zone would be a dream of mine, to live in a blue zone. Do I see it where I am currently? Probably not in my lifetime, but I would love for that to happen here. How do we move forward? It's got to be the common things that people are looking for. What are people aware of? Like going into the supermarket and being able to realize there's a whole food plant-based section. There's a section that caters for healthy cooking, having these demonstrations in the local supermarket, making this language so common that people are saying, oh yeah, we are eating a protein burger, we're doing a plant-based this and plant-based that. The language is becoming very common, and people are opening up to understanding that, you know what, I'm going to make a plant-based choice. It's becoming the word everyone's looking for, the vegan buzz or the whole food plant-based buzz. It's becoming the trendy word. People are picking up on this and they're wanting to be part of this culture. And I think it's got to be it's going to be setting from a culture standpoint, right? We have to use this as a way of living. It's got to be part of our culture. It's got to be the American culture or the world culture, that this is what we do. We're eating food that gives us life. We're not eating food that is rotting within our body. We're eating food that is life. And I think once we embrace this as a culture and a way of living, I think that's the only way we're going to turn this into blue zone. And people just have to realize that this is the society that we live in. It's become a society that's too fast paced, and decisions are not being made at the right time because of so many things that are on our plate. So just taking time for self, taking time to heal, taking time for perspective, and changing this culture is how we're going to do this.
I think I agree with you. And you said in a very beautiful way, actually, that this is not a fad diet. This is not something we're going to do it for 6 months or a year. This is a changing the lifestyle for individual and changing the culture of the whole society. It has to be a culture of the whole society, because if one person is lagging behind, if the culture of the society has changed, that person will catch up. So this cannot be done individually. It has to be the culture of the whole society, as American, even as a world. I think we have to change the whole culture. So my last question is to you is that we have now this 18 pillars. Initially, I thought 6 pillars are adequate, but I realized that a lot of people right now, their priorities are different. They are not into health. Maybe they are tied up with other obligations. Many people are not even aware how healthy or unhealthy they are. So we have to bring them in our camp by providing whatever their interest is, whatever their needs are, whatever their priorities, whatever their choices are. So we have expired 18 pillars. What do you think of our 18 pillars? And do you think that kind of approach will bring us closer to achieving that blue zone status?
I think what you're doing, Dr. Shah, is brilliant. I think you are appealing to all people in society. You're being inclusive, and inclusivity is very important in order to attract. And that's exactly what you're doing. And you're attracting people into different topics that they want to learn. And I think it's a great approach. And you're providing a service that is hands down probably one of the best services I've seen. And you're doing all this on your time without having recognition. So I want to recognize you for the great work you're doing. And I think it's a great platform for bringing people with multiple interests and being able to see that you represent not just health, but everything that frames us as human beings, from the financial part, from the empowerment part, from the parenting, from the cooking, the financial health, from the entertainment center. I think what you're doing is just fabulous. And I think it's a great way to attracting people and including people from all diversity in all parts of the world and for their various interests. So I applaud you for that.
Oh, thank you. Thank you. So again, this kind of concludes our 1 hour live today. We will be bringing Dr. Reddy's back soon, hopefully. But this video will be on YouTube in a few hours. So please watch it again. You will learn new things as you watch 2-3 times. Please also share these YouTube videos with your friends and family. And again, I always request all of you, invite 25 friends to like our page. We are all together as a team. We are all growing together. We are all learning from each other. We are all motivating each other. So please, please invite 25 friends to our page. Thank you, Dr. Reddy. We'll see you again soon.
Thanks, Dr. Shah. Have a great day.
Thanks.
Thanks for having me too. Thank you.